Some very, very common questions that are asked of me by my patients that are considering rhinoplastic procedures is, number one, does the nose have to be broken? And number two, does it hurt? And I'd like to address both of these in that, number one, rhinoplastic surgery, as a rule, is truly not a painful procedure. I would describe it more as something that may be uncomfortable for a few days. And the reason I say that is that the procedure itself actually reduces the sensory nerves, or the nerves that you could feel pain, are separated from the structure. So initially there's somewhat numbness of the nose itself. So that reduces a great deal of the pain. And very often patients following rhinoplastic surgery only require something like an extra strength tylenol. Very rarely do they require any real heavy narcotic medications following the rhinoplastic procedure. Now, the discomfort is basically because patients, even though they may be obstructed prior to the surgery, they're not totally obstructed. And after you perform the internal and external portion of the nose, very often the swelling and the little bit of the dressing that might occlude the airway creates a total situation of mouth breathing, and that sometimes is somewhat difficult for patients to experience. So that is more of the discomfort rather than pain. Now comes the next question of, does one break the nose in performing a rhinoplastic procedure? Now, you have to understand, we really don't like to use the word breaking the nose like if you were in an accident or something of that nature, where you'd have a hit or someone in an altercation might be hit and would break the nose. The nasal bones sometimes have to be repositioned, and they're done very carefully with very delicate surgical instruments. So you do separate often portions of the nasal bones in order to move them in a particular direction, either moving them in or moving one bone in and another bone out to correct a deviated nose or a twisted nose. So the term of broken nose is not something that, as the rhinoplastic surgeon, I would use, but the nasal bones do have to be repositioned in most cases where there is a full rhinoplastic procedure.